A close association between diabetes and depression exists. Patients with diabetes have a high prevalence of depression. The possibility of a common biological pathway, such as inflammation, as an underlying mechanism of this association has been suggested. Multiple mechanisms are involved in the association between diabetes and inflammation, including modulation of lipolysis, alteration of glucose uptake by adipose tissue, and an indirect mechanism involving an increase in free fatty acid levels, blocking the insulin signaling pathway. Depression enhances the production of inflammatory cytokines. Overproduction of inflammatory cytokines may stimulate corticotropin-releasing hormone production, a mechanism that leads to hypothalamic pituitary axis activity. Conversely, cytokines induce depressive-like behaviors. In studies where healthy participants were given endotoxin infusions to trigger cytokine release, the participants developed classic depressive symptoms. Based on this evidence, it could be hypothesized that inflammation is the common biological pathway underlying the association between diabetes and depression. C-reactive protein, or CRP, is a protein found in blood plasma whose levels rise in response to inflammation and can be measured with an hs-CRP test. In this study, because of the absence of data on the direct association between inflammation and depression in patients with diabetes, we examined the association between hs-CRP levels and the high prevalence of depression in adult patients with type 2 diabetes. Cross-sectional data were obtained from 3,573 patients with type 2 diabetes recruited from a Japanese diabetes registry. Mean age, body mass index, and glycated hemoglobin levels were 66 years, 24.6 kilograms per meter squared, and 7.4%, and 122 patients suffered from major depression. We observed a significant positive association between high hs-CRP levels and depression in patients with diabetes who had a high body mass index.